Hey guys, my name is Kat and I was the Grow Internship Coordinator for the 2024 Grow Internship with GlobeMed, and I'm here to introduce Grow to you. So Grow stands for Grassroots On-Site Work Trip, and essentially it's a 4-week internship over the summer at ASADE in Guatemala, where you get to do a lot of different public health activities, like workshops, things like that, also a lot of clinical activities, and it's a really great opportunity to continue doing what we do in GlobeMed, but over the summer. So there was a very wide range of stuff that we actually did there. We did a bunch of clinical stuff, so if you're pre-med, that's a plus. A lot of hands-on work with like taking vitals, doing patient histories, patient intakes. We ran basically pop-up clinics and did a lot of that and got a lot of patient interaction, which was super cool. That was out and about in different communities, but then we also worked at ASADE at their clinic itself and learned how to do ultrasounds and learned about pap smears and other reproductive healthcare, and also a little bit of kind of pharmaceutical stuff as well. And essentially that was one big piece of it, but there was a lot of other stuff. We did workshops for oral care and like schools with a bunch of different kids, which was super nice. And we also did some first aid workshops for teachers at those schools to teach kind of firsthand easy treatments of simple kind of cuts, scrapes, etc. And then also we did a bunch of education workshops for nutrition and water filtration. We actually implemented water filtration units into a bunch of different homes in a community that ASADE is partnered with, and did some sessions with the families to explain kind of how that changes their day-to-day practice and like how to treat the water versus what they would normally do. And then on the weekends, we didn't have any work, and we would go on kind of mini trips. We went to like Atitlan, we hiked Volcano Acatenango, we went to Montego Beach, and then we also got dinner with Julio and his family and some of the doctors that we met along the way. I think my absolute favorite day of the whole internship was the last Wednesday that we were there, so midway through our 4th week there, and we ran a pop-up clinic in a community in Chimaltenango, which was like kind of close to ASADE, but a little bit further than some of the other communities. And essentially we set up and ran a clinic that day, and we did all the patient intake, all the vitals. We had a doctor there who works with ASADE who was writing prescriptions and seeing all the patients, and then we ran kind of like a little pharmacy area, and then there's also ultrasounds going on, so a lot of different things happening, but it was kind of the culmination of everything we've been working on. So practicing our Spanish, practicing our like clinical skills, practicing just talking to people and being there for them, because these people, some of them came a long way because these people can't even make it to ASADE. So it was really nice to kind of be able to bring something to them. And Julio mentioned it was one of the most had one of the highest attendance rates of the travel clinics that they've done. We saw almost 100 patients in about 7 or so hours, which was a lot, but it was so nice to be able to know that we actually did make a good impact. And like I said, it was kind of the culmination of all the different things we've been working on. We passed out like toothbrushes into kind of mini pop-up education sessions as patients were waiting to see the doctor, everything like that. So it was a really cool pièce de résistance, if you will, for the whole trip.
Yeah, my name is Landry Fan, and I'm currently a sophomore hoping to double major in neuroscience and public health, as well as minor in philosophy. I would sum up the Grow internship using words like community-driven, enlightening, and challenging. Come in with an open mind. Julio, who is the director of ASADE, is somebody who will constantly ask you to reflect throughout the internship a numerous of times. So you need to be incredibly reflective, as well as come in with a mind that's ready to be humbled, Even though the healthcare systems in the US and Guatemala are quite different, Guatemala can definitely teach you a lot of things when you are an aspiring pre-med student or someone who just wants to work in public health or just somebody who wants to work in the community. And don't expect this to be just a simple resume builder. The work that you're going to be asked to do can be challenging sometimes, ranging from just waking up early in the morning to commute, or even just walking for a long times and speaking a language that you may not be native in or fluent in. Also, just be enthusiastic. The people there are very kind, and they may be mistrusting at first, but show that you're willing to help them and you're happy and excited.